I'm David Grabowski. I'm a professor of healthcare policy at Harvard Medical School, and I study the economics of long-term care. Long-term care is so important to all of us. It's important from a policy perspective, but it's also important from a family perspective. And I believe my research kind of touches on both of those. So we need to understand how our government pays for services, regulates services, worry about covering services. And then on the family side, family are the largest providers of long-term care, and we need to worry about how we're supporting family members, how family members are interfacing with formal caregivers, with policy. And so I would tell somebody that long-term care is an issue you should care about because it's a policy issue, but it's also a family issue. And both of those are important if we're gonna sort of address all the problems that are out there with long-term care. I'm super interested in European countries, and I think long-term care is a little different. When it comes to healthcare spending, the US is an outlier. We outspend everywhere else in the world. When it comes to long-term care, however, we're really an inlier. We don't spend more than other countries. In fact, we're kind of like right in the middle of the distribution. And so what I always tell people, we can learn a lot from our European friends and friends around the globe in terms of what they're doing in long-term care. We're not the odd ones who are outliers here. We're part of the herd, and there's a lot to be learned. I think there's several reasons that we don't spend a lot of money on long-term care in the U.S. I think the first is maybe that we don't value older adults the way some other countries do. I think in many European countries and many Asian countries and other places around the globe, there's a real respect and kind of love for older adults. And I do think we in the U.S. love our older family members, but I don't think we're necessarily willing to invest in the kind of policies to support them. We very much make it a family issue and put this on the backs of caregivers, wives, children, neighbors, rather than really investing in the formal resources to do that. So I think that's a big part of the reason is that we don't value kind of the care of older adults. I think another part of it is that we in the U.S. spend a lot of money on healthcare services, and some of that spending on healthcare crowds out long-term care spending. When you look at our European counterparts, they're spending those dollars on long-term care. They're spending a lot less on healthcare. If you ask me, I think these countries in Europe, especially in Northern Europe, are really doing a great job. They've figured out the right balance, invest in long-term care more so than healthcare. I think that's the right combination. I think we're off in the U.S. So in the U.S., I think we do a relatively poor job of coordinating or integrating healthcare with long-term care services. This goes to our fragmented payment system and fragmented delivery system. And I think the different payers often aren't talking to each other. So even for an older adult in the U.S. who might need long-term care services, his or her health care is covered by the Medicare program, but their long-term care is either covered by Medicaid or the individual's paying out of pocket. You would think, well, at least in the case of Medicare and Medicaid, those are two government programs. Clearly, they're working closely together. You'd be wrong. They're very poorly coordinated. Oftentimes, Medicare and Medicaid aren't working together. Sometimes they're even working against one another in terms of shifting costs to the other programs. So care is very fragmented in the U.S., unfortunately, and that's led to kind of worse quality and higher spending. So I think long-term care has a long way to go in terms of being a major part of our policy agenda in the U.S. I had my hopes up during the pandemic. It was a very dark time for long-term care all over the globe, but in the U.S., we had a lot of COVID cases and a lot of COVID deaths in long-term care settings, especially nursing homes. I felt like with all of this attention, we're going to see kind of major policy shifts. There were commissions, there were reports, there was media, there was just a light was shown on long-term care. And I had maybe naively thought this is going to lead to big system level changes. Ultimately, it didn't. It's fallen back down on the agenda. It rarely comes up, for example, in presidential elections. It's rarely part of the candidates' platforms. doesn't come up in presidential debates. It doesn't come up in State of the Union addresses. Basically, I think a lot of individuals in the U.S. Don't hold, our policymakers accountable for long-term care. And so I think for a while it was getting a lot of attention, but now it's kind of fallen back. I don't think this is towards the top of our priorities. I will say there were several steps coming out of the pandemic. They were all important, like minimum staffing standards and more ownership transparency and accountability, regulations. Those were all good steps, but in the bigger picture, they were smaller steps. And I think in order to fix a U.S. system, whether it's how we pay for care, this fragmentation between Medicare and Medicaid, we need big system level reforms, and that's certainly not on the horizon. Yeah, so if I was kind of put in charge, and nobody's going to put me in charge, or if somebody did, uh, I would want to start with our financing system and how we pay for care. And that's really hard to start there. But I think without changing kind of how we pay for care, you're stuck. As an economist, it's not surprising. I'm really worried about payments, but I think we have a real issue in the U.S. about what we pay. We underpay for a lot of services, how we pay, and then whether those payments are, as we talked about earlier, coordinated with other kind of payments for healthcare. And then finally, whether these providers, whether it's a nursing home or an assisted living facility or a home care agency, is actually delivering the care that they were paid to do. We have issues of accountability, but we need to fix regulation. We need to fix delivery, staffing. There's lots of pieces. I don't think you can do any of that unless you first start with financing. So start with financing, then it's regulation, and then fitting in the sort of delivery level pieces like what's the appropriate mix of staffing, et cetera. So our data has come a long way. When I first started, so I got my PhD in 1999. The data were a mess. They were fragmented. There were tons of gaps. I think over the last 30 years, we've seen a real evolution in terms of just the data sets that are available. And we're not all the way there, and we haven't connected all of them, which is a key issue. But we're so much further today in terms of having assessment information in the different settings, having claims-based information on what we spend in the different settings. It used to be in the U.S., we didn't have information on all the individuals who were in the Medicare Advantage plans. This is the managed care version of our payment system for older adults. Now we have those data. We used to lack Medicaid information. Now we have those information. We used to have very poor self-reported staffing data from the nursing homes. Now we have administrative payroll data. We made a lot of steps forward and filled a lot of gaps. So I'm very hopeful about the data sets and what we can answer today versus 20, 30 years ago. That's not to say, however, that we still don't need to have work left to do in terms of connecting all of these data sets. And given how much of our care is, at least long-term care, is paid out of pocket, and then how much of that care is delivered by families, those are two of the holes that still exist out there. Because I still think we have survey data on family caregivers, but it's often hard to link that to broader claims information. I think that's one of the areas that we still have work to do. So I'm super excited right now to think about workforce issues. That's been an area that's plagued the U.S. long-term care system for decades. We just can't find enough workers that want these jobs. And as an economist, the first explanation is, well, gosh, we should just pay them more. But even as we've raised wages, especially following the pandemic, we still haven't been able to attract the numbers of individuals we need. These are challenging jobs. I don't think we often value these workers and give them enough responsibility and allow them to work up to the top of their abilities and their credentials. I've been super interested of late in a number of issues around how do we meet the staffing shortfalls. What's going to be the impact of this new minimum staffing standard in the U.S.? I've done a lot of work recently on immigration policy and how that intersects with long-term care policies. Immigrants are a really important part of our workforce in the U.S. In fact, I think without them, we'd be in dire shape. So it's a super important that we grow that. That's not exactly where immigration policy is right now in the U.S., and so there's this real disconnect. We're also, this is true in every long-term care system in the world. They're all throughout Europe. We're all looking for individuals who want these jobs, who can do these jobs, given the kind of demographic situations across all of these countries with the baby boom generation reaching their long-term care year. So very interested in staffing, very interested in still in how the pandemic, changed long-term care. And we've seen this shift of individuals receiving a lot more care in the home and the community. That's potentially a good thing because that's where most of us want our long-term care. The not so good part about that, obviously, is that that may put a burden on families. That may allow certain families to access that care and not others. Some of us may be able to afford private pay services in the home. Others of us may not. And so thinking about some of the equity issues and the efficiency issues around transitioning care out of institutions and into the home. And then one final area that's been really fascinating is just in the US, most long-term care providers are owned by for-profit companies, and that's always been true. But more recently, we've had a lot of private equity companies and I guess very complex corporate structures that have come into play in these areas that we had never seen before. They used to be very simple, common kind of owner-operated entities, and today they're very complicated companies with lots of parts, and it's very hard to follow the money and also know who to oftentimes hold accountable for quality of care. So I'm very interested in sort of the ownership structure as well of our long-term care system.